is more for in regard to people who are working in maybe the substance abuse field or therapists or treatment providers, but you really want to get family, friends, supports, and other agencies involved. After all crises, it's important to gather whatever supports a person does have and get them involved. If they don't have supports, it's time to get them some. The idea of arranging a robust referral, right? Basically, this means you just don't give numbers. You check up with them. You have them call from your office. You have them call from your phone. You make sure you drive them maybe to the next appointment, right? If the person's already in treatment, or if they're not already in treatment, have them call their local treatment center for an assessment. If the person is already in treatment, have them meet with a recovery support specialist. Maybe a higher level of care is needed. Maybe they need to go to detox or they need to go to residential and inpatient. Detoxification center. If they've been using for a while, they'll have to call detox. Spera is a really great place that works with the University of Michigan Psychiatric Center, and they'll work with them if need be. Psychiatrists, medication therapy may be in need. Have them evaluated by a psychiatrist. If the person is talking in a bizarre fashion, their thoughts seem to be unreal or paranoid, they're having auditory or visual hallucinations, get them to the hospital. They can start them medications and release them once they get stable, and then they can start working on substance abuse treatment. All right. Other mental health services, there's things like partial hospitalization services, there's crisis response teams. I can give referrals to those to anybody who wants to know a little bit more about those in our county afterwards. Case managers, I can tell you a little bit more about case management or in-home therapy. But more importantly, everybody can do this. You follow up with the person about their attendance at mutual support groups, at their therapy appointments, at their mental health appointments. Continue to ask about suicide. We are in a room full of people that constantly ask when a person's sobriety date is, right? If they felt triggered to use, we ask weekly in groups if they're expecting or experience any sobriety-threatening situations. If someone relapses one time, it is enough material for us, the folks in this room, to talk about for weeks or even sometimes months. We need to take that same spirit and bring it to suicide prevention. If someone talks about suicide, we need to ask and we need to keep asking, right? Increase frequency of care by creating more contact. It's really important that after a